So welcome everyone. Thank you for joining us today for DEC Awareness Day and for our All Hands on Deck call. I am Carrie Jensen. I am our Alliance Communication Training and Support Coordinator, and I'm here today with our Executive Director, Scott Henderson. We'll be kind of running the show today and letting you hear from a whole bunch of our partners and some exciting things that we have to share today. I'm glad to see a whole bunch of red on everyone too. Thanks for wearing red and supporting our DEC Awareness Day today. So we're going to jump right in. We are really excited to have several of our partners share some of the great things that they're doing. And we have so many more of you that are sharing awesome things on social media. If you haven't had a chance to go to our social media pages today, jump on there and look at that. We're trying to reshare all the posts that you guys are doing and all the awesome events and social media posts that you guys have going on. So please take time to check all of that out. There's a lot of great stuff happening. All right, so to start off today, we have some folks from Worcester County, Massachusetts with us. We have Ellen Miller and DA Early that are going to share some of the DEC efforts and some of the things that they are doing today for DEC Awareness Day. So Ellen and DA Early, I'll turn it over to you.
Ellen, aren't you going first or am I going first?
No, you first, DA.
All right. It's great to see everyone. It's great to be here today on National DEC Awareness Day. Let me get that off of the screen. And it's great to speak with the National Alliance on Drug Endangered Children Day. You're all here because you get the same thing. You got a passion for this. You want to make a difference. You want to make things better. And we here at the Worcester County District Attorney's Office are really excited. Thrilled actually to be working with the National Alliance to address the often underserved population who are traumatized. The kids who have suffered trauma due to the experience of witnessing something that's in line with drug abuse. When I first became the district attorney, I remember speaking to my father, and he talked often when I asked him questions. He never took credit for anything, but he talked about how it's so important to deal, for example, with nationally on health issues. And I said, why do you do that, Dad? And he said, well, 95 cents of every health dollar goes to treatment, 5 cents goes to prevention. So while we got to treat, we got to do more to prevent. And the more I learned about prevention and intervention, I found that really there are two best crime safety tools, but they're always underutilized. They're always underfunded. And it really doesn't make any sense because they work. And by putting a focus on keeping kids busy after school, dealing with trauma, working with all our community partners, not caring who gets the credit, we've reduced our juvenile delinquency complaints by 79%. And we know that kids who don't get help, kids who experience trauma and don't get help, 40 to 60% of them are going to end up in the criminal justice system. And just as sad, 40 to 60% of them are also going to end up with a substance use disorder problem themselves. So we've got a duty, and by working together, we can do something about this, and and help kids, help our most needy, with the effects of trauma. In 2019, our office invited experts from the National Alliance for Drug Endangered Children to speak at our Safe Schools Summit, something Ellen Miller has been putting together year after year after year. And they spoke about trauma reduction and how to save some of our most at-risk kids. They made an incredible impact. And I knew right then and there that we had to create a Worcester County Alliance to address trauma and its effects. So we jumped right in, and the work has been ongoing. We recently announced that our office has been awarded a $1.6 million grant that will assist with the effort. It always takes money. You always got to have money. And too often not having money is the excuse. But if you keep working and you get a passion for it, a lot of times you're going to find a way to find that money. And we applied for the Comprehensive Opioid Stimulant and Substance Use Program, the COSUP grant. I knew that if we were successful getting the grant, that we were going to make a big difference in the lives of kids who've been traumatized and prevent future heartache associated with trauma. And thanks to Amy Colgan helping us write the grant, and Ellen being a bug in her ear and my being a bug in both of the areas, we were thrilled to be awarded the COSUP grant, and the National Alliance for Drug Endangered Children is one of our partners, a huge partner. Currently, National DEC is assisting us with community needs assessment in Worcester County to determine our next steps for the local alliance. National DEC is also going to play a very important part in instruction training to our Worcester County Drug Endangered Children's Alliance. Our goal is to bring together all of our partners. You know, there's no I in team, but there are two an idiot. If you don't care who gets, it's a joke. If you don't care who gets the credit, if you don't care about egos, if you work together, work with law enforcement, schools, social workers to increase child safety and empowerment, raise awareness on the effects of trauma, and provide a network of support to these kids to ensure they have equal access to the services and care they need when they need it most, you're going to be successful. We're going to continue to work to identify those kids and provide a soft touch, a warm hug when they need it most, and to do everything we can within our power to help eliminate long-term trauma. So we appreciate the partnership with National DEC and their ongoing work to help us all get better when it comes to assisting these kids. We couldn't have a better partner with National DEC. Thank you so much, and it's an honor to be here today and talk to all of you. Thank you.
Thank you. I'm just going to show a few quick slides. Almost to recap what the DA just said. We've been so lucky these past few years. We were stalled a little bit when it came to COVID and the pandemic, but we still were able to meet virtually. We were happy to be part with Plymouth County of the Academy, the DEC Academy, and to go on to become Train the Trainer. We came back and trained our entire office. We were participating in Wear Red for Awareness Day. So we gathered a group of not only DA Early's employees, we had the Worcester County Sheriff's Department there, local police, the DA's Child Advocacy Center, the head of the Opioid Task Force, even some of our public health officials that were able to participate in this day with us because they also know they want to work again with us and with DEC and push this mission. The DA mentioned the readiness survey. We've been trying really hard. We're 60 cities and towns in Worcester County, which is amazing, and they do some amazing work, and we're trying to pull that all together. So I think right now we have about 2/3 of our county covered that have filled out the survey right now. And we're just looking to fill in a couple of those gaps. And I'll just share our last post, whether it was from the conference 2 years ago, countywide trainings and presentations that we do. We're really trying this multi-pronged approach to just spread the message out there. You know, DA Early keeps talking about prevention. He has a really robust community outreach team, and whether it's community and school programs or opioid prevention and programs, we're really filtering that message out there. So thank you for giving us a few minutes to speak today.
Thank you so much, Ellen and DA Early. We do appreciate the partnership with you guys too. I also see Amy on that DA Early mentioned to help writing the grant, and we are lucky to partner with you guys. We have a good time, and there's a lot of awesome work that's being done up in your area thanks to all of your efforts. So thank you so much for being part of everything today.
Thank you, Carrie. Thanks to everybody at National DEC. We appreciate it.
Thank you. All right, we're excited to move on to our next person. We're going to have Tabitha Curtis, who is the statewide coordinator in Tennessee, kind of share some of their efforts and some of their information. And Tabitha is also one of our board members at National DEC, so we're glad to have her support in many different ways. So Tabitha.
Hey, good afternoon. Good to see you, DA Early again. So, well, of course, everyone's aware that today's the National Alliance for Drug Endangered Children Awareness Day, and of course, we're celebrating that all across the state of Tennessee. We expand our efforts from West Tennessee over to East Tennessee, and we've been doing that by the lighting of landmarks across the state. Over in West Tennessee, we have a pyramid over at the Bass Pro Shop that will be lit in red tonight. We have an Eiffel Tower replica over in Paris, Tennessee, that will be lit in red tonight. I'm currently at headquarters in Nashville for the Bureau, and we'll be going over to one of the local parks, the Bicentennial Mall Park here in Nashville, for a statewide proclamation reading this afternoon at 4. But we have a Korean War Memorial Bridge that's going to be lit tonight here in Nashville. Over in our eastern side of the state, we have the Tennessee Aquarium over in Chattanooga. that will be lit in red this evening, as well as one of those beautiful giant Ferris wheels over in East Tennessee, and the Sky Bridge that's over there. All across the state today, not only have we been partnering and having our drug endangered children response communities doing their reading of their local ordinances, but their yard signs, red pinwheels, displaying wearing the red, but also other community coalitions across the state who've partnered with us. And it's been very exciting that we've been able to take yard signs, balloons, pinwheels, and spread that information all across the state about the awareness of drug endangered children. But one of the things that I do want to highlight that we have been doing with our current 7 drug endangered children response communities is we've been not only wanting them to share with the people the message about the drug endangered children across our state, but also share with them the efforts, the outcomes that they've been able to produce by being a drug endangered children response community in the past year. Carrie, are you still there?
I'm here, yes.
Okay, I just wanted to make sure that I'm in the back of a truck. So I just wanted to make sure everybody could still hear me.
Yep. Were you going to share anything else? I didn't want to cut you off.
No, also I was going to share that we've been doing television interviews this morning from over in East Tennessee. I did a television interview with a news station out of Chattanooga, Tennessee. And here in Nashville today, we'll have local news stations that will be here that will be reporting to as well. We also partnered with our Tennessee Bureau of Investigation public information officers, and they sent out the press releases. So we've had other entities across the state who've been doing, whether it be radio spots or television spots, to share the information and create the awareness around drug endangered children, as well as the outpouring social media presence today so far.
If you haven't had a chance to check out some of the social media stuff, Tennessee has done an awesome job. They had some videos that they've done beforehand that might have just been even recorded on a cell phone, but it's something that's very effective and it's out there and it's getting the message that's easy to spread far and wide. So they have some great resources to look at for some ideas for the future, or even things you can do later today and still get out there.
And I just want to say to DA Early, I know that we had conversation back at the summit a couple of weeks ago. You talked about building it, and you start small, and if you build it, everyone will come on board. And that's what we've been able to see in the state of Tennessee. We've got some new partners coming on board with us, the Tennessee Department of Corrections, the Office of Criminal Justice Programs, and the Tennessee Department of Health, the Tennessee Department of Mental Health Substance Abuse Services. So if you build this, people will come. And the more that you can show that you are working collaboratively and everyone is at a stakeholder at your table, they will come and be a part of it when everybody sees the results that your organization or your county is having.
You guys did a great job with that. And I had asked the question, and Tab, I think you were thinking about it a little bit. What happens when egos get in the way? And I think that's a great way. You get everyone else there. You're going to squash those egos. People end up doing it for the betterment of everyone.
Oh, absolutely. And, I think we've seen that ongoing, that it doesn't matter who gets the credit. And I think you said that, DA, early. It doesn't matter who gets the credit. When you're talking about children and families, and it doesn't matter who's getting the credit as long as the work's getting done. And when everybody's working collaboratively together, it's for the betterment of the children. It just gives us all a voice for the children and the families across our state. And it makes your organization, and sharing that with them, making your organization a part of the bigger picture. So I think that helps tremendously.
Absolutely. Tabitha listed off a lot of the organizations that they're able to collaborate with, but one she didn't mention is they do have a lot of faith-based organizations that are partners and collaborate in their collaborative efforts. So that's something they've done really well in Tennessee also.
Yeah, our Tennessee Department of Mental Health Substance Abuse Services, they have a faith-based division in their organization. So that helps us tremendously as well.
Thank you so much, Tabitha. And thanks for being on the road and sharing that stuff with us as you're heading to your next theme.
No problem. We're glad to be part of it today. It's so exciting.
Very good. Thank you so much. All right, our next group that we're going to have share is from Michigan, and we have Libby with us from Michigan. She's the Michigan DEC Alliance Coordinator, maybe if that's her official title. But Libby was just doing a training right before this, so I'm glad to see that she's popped in. And so, Libby, I'll let you share some things now.
Thanks, Gary. Thanks for, giving me a few minutes today to share what we've been doing. So the big thing, I guess, that we did for DEC Awareness Day was trainings. We had a DEC Awareness training this morning, and then we had a DEC Approach training this afternoon. And so that's something that we've found to be pretty effective for us, is just to have both of those opportunities frequently and kind of at the same time, because then we recently had a trainer session, and then we knew that, we were going to have a big group of people who were eligible, who had gone through the required trainings on DEC Awareness and DEC Approach. So that's been a big thing that we've been trying to work on, just in terms of building awareness and getting people across the state familiar with the mission and the DEC vision. So I think, over the past few years, we've been able to train over 1,000 people, and this morning we had about 65 in our virtual training, and then 70 this afternoon in the DEC Approach training. So we've also found, that virtual works pretty well for us. It eliminates the transportation barrier, the costs that a lot of people face. So that's worked pretty well. We've gotten a good turnout. I think Carrie, you helped us to sort of get the word out, which helped with our turnout. I think also being a state organization, we have a bit of an advantage in terms of just our reach, our ability to, get more people to our trainings. We are based out of the Michigan State Police, so we have a pretty good reach there. And we also are lucky that our state police organization will put our content out on, social media, their websites. So we've got kind of like a good following built up already. And so advertising our events today, we did a lot of social media. We did that throughout the month, sharing videos and some stats and just some things that we've been working on over the past few years. And we had that come from our central public affairs office with the state police, but then also from public information officers at different posts across the state. So I think that helped too in terms of our reach. And then we also had some information shared out in a newsletter from our organization. So we tried to hit, just sort of those basic channels: social media, email, newsletter, website. We've also been working on videos. We have one that we did that's been circulating out for a while. We're working on another one. We had hoped that it would be ready to share out today, but we're not quite there. We're almost there. It's completed. We're just putting some finishing touches on it. But with those videos, we tried to show, how children can be affected by parent or caregiver's substance misuse. And then also in the second video, more of a focus on the professionals and how we can all kind of come together and collaborate, and how that makes a difference. I think also, we've had a lot of success with the virtual trainings because National DEC has, kind of thought through like how to make them engaging and interactive. So even though we're in this virtual space, it's still, we get some really good participation. I think, I appreciate you guys doing that, because I think the breakout rooms and the activities really help to get people talking. So that's nice to see that even though we're in a virtual space, we're not really, maybe we're losing some amount of connection, but I think we're able to still have a lot of it. Yeah, so that's the main thing that we've been doing today, is the trainings, and then just different sorts of digital awareness, social media, websites, videos going on there.
Awesome. Thank you, Libby. Since we have some time, I actually want to show the Michigan PSA, the one that Libby mentioned. I know they're working on a second one, but it's something that it's powerful, it's simple, but it's something that I want you all to be aware of, and it's something available that you can even share in your communities also. So let me pull that up for you.
Some kids like to pretend they're grown up. Some kids don't get a choice.
Today will be a better day, Mommy.
When a parent or caregiver has a substance use disorder, children are at greater risk for abuse and neglect, and more likely to develop substance use disorders as adults. But with early identification and support, families can turn their lives around. Learn how you can help.
So just a great example of the work that Michigan is doing, and that video, like I said, is very powerful, and they've been able to get that out far and wide in their community.
Thanks, Gary. I'm bummed we don't have the second one ready yet. It's so close, but I can send that to you when it's done so you can share it with everybody too.
Yeah, their second one, they've shared kind of their plan for that with us, and I'm excited to see that when that comes out. So we'll probably share it on our social media pages once it's available, so keep your eye out for that. All right. And I love all the trainings that Libby's been able to do leading up to it, a lot of advertising and stuff leading up to today, and letting people know that today's DEC Awareness Day, and just by having a training, taking the time out to learn a little bit more is something that's really, really helpful. All right, we're going to shift gears just slightly. So thank you all for sharing your DEC Awareness Day activities and events. We're going to talk about something else that we're really excited about, our national conference. We have that coming up in August this year. And we're going to give you a little teaser with one of our presenters that is here today. And he's going to share a little bit from his session, and that's Burnette. So I'm going to give him a little bit of time to talk about and share what his session will be about at our conference. And then I'll tell you a little bit more about the conference after Alan finishes.
Okay. Good morning, everyone. How are y'all? Afternoon. I really don't know where to start. I guess I am the Franklin County DEC coordinator, which is in a little small town called Winchester, Tennessee. I have several different hats that I wear, as some people would say. I am the Lifeline or Project Lifeline Recovery Coordinator, which covers 13 counties in South Central Tennessee. I've become a coordinator in 2013. Been doing this for the past 9 years, reducing stigma related to the disease of addiction. So what I do in the communities that I cover is I go around and I educate those communities, implementing recovery support services, programs, things like prevention coalitions, recovery courts, NA meetings, AA meetings, faith-based recovery meetings, accessing individuals to treatment or recovery support services. And let's see, what else should I add with that? Oh, I'm a person that's in long-term recovery. So I think it was DA Early that was talking about that he has a passion for the work that he does. I'm very passionate about what I do, having that lived experience and going around each and every day trying to reduce stigma, but also trying to reduce trauma. Trauma is something that I don't want to see anybody ever have to experience. But that's what I get to do every day. I've been doing this since 2013, but I've been in recovery since 2006. I just celebrated 16 years of sobriety after struggling with a little over 20 years of addiction. And so this is home to me. A lot of people say that I got a good job and this and that, but it's not a job to me. It's my lifestyle. I was doing what I'm doing now before I ever became the Lifeline Recovery Coordinator. And just here recently, whenever Tennessee Alliance for Drug Endangered Children got together, I became a board member. Tabitha Curtis, she was my coalition director when I started Lifeline, and she took the lead on the Alliance for Drug Endangered Children here in Tennessee, and she pulled me along because she knows the work that I do in the communities that I cover, reducing stigma. And whenever she did that, it really made my job as a Lifeline coordinator come full circle. And that's what I'll be presenting on a little bit in Kansas City. And I will also share some things with you if you come to the conference about what Missouri, that relationship that I have with Missouri. But I'll hold on to that until then. But whenever the Alliance for Drug Endangered Children started here in Tennessee, I was, already reducing stigma with like law enforcement and the courts and things like that right there. But it really made me put more emphasis on trauma and law enforcement, the courts, DCS, because we have to stop continuing to lock individuals up, because all that do is increase the trauma. And that also keeps our families from being together. So what law enforcement has started doing, as well as the courts, as well as DCS, because have built those relationships, they have started reaching out to me as the Lifeline Recovery Coordinator and asking if I can get those individuals into treatment whenever they are in a drug raid or got them pulled over or they have failed their urine test. If I can get them into treatment, then they won't send them to jail, or they won't take their kids away from them for a long period of time. And most of the time, because of built relationships with the different treatment providers across the state of Tennessee, within a matter of minutes, I've been able to get those individuals into treatment. And I think it's a wonderful thing that whenever law enforcement and judges reach out to me after they've chased me down, they've locked me up, incarcerated me and this and that, but they trusted me so much that they can call upon me and I can make it happen, or get those individuals the services that they need. So the position come open here in Franklin County for the coordinator, and I jumped on that, and I'm taking the ball and running with it. I wish I had more freedom to do what I want to do, but I gotta go with the guidelines that my coalition director now will allow me to do. But we're getting there. Today we did a proclamation signing with our county mayor as well as our community partners. And we have so many here, and I think it's a great thing that when we have our community that comes together, because our community is what helped me to get to where I'm at today. Our community and the education. And after the proclamation signing that we had, I had a young lady that I met at a treatment facility that she told me a little bit about what she had been through. And she was a drug endangered child. She was also a drug endangered parent. And I brought her along, and she shared a little bit of her story today. And I wanted our community partners to see that, that if you give somebody love, support, some structure, some education, they can become just as successful as I have been. And I also didn't mention that I am a drug endangered child. And as you guys heard, and you can put together, that I was also a drug endangering parent. And I know how me growing up, how that trauma affected my life. And I know that since I've been clean, the impact that I've made on my kids' life. I have 3 daughters. I raised 2 of them, and neither of them have ever seen me pick up an alcoholic beverage, any type of drug, and they probably haven't seen me, they haven't seen me pick up a cigarette or smoking anything in the past 9 years. So that's a little bit about who I am. That's a little bit about what I will be presenting on out in Kansas City, Missouri, out there in the Show Me State. And hopefully that whenever I get there, I can show you guys a little something.
Thank you so much, Alan. We're excited to have you, as we have several of our presenters on the call today that will be at the Missouri conference. So we're looking forward to hearing from everyone and to having that conference a little bit later this year. Let me share my screen here again. We appreciate everyone sharing your information today. Like I said, I wanted to talk a little bit more about our conference. If you scan that QR code or go to our website, as of today, we're able to start leaking out some of our agenda and letting you know the exciting things that you can be looking forward to as you come to the conference. So a lot of great stuff. We will have a documentary screening. We're going to have a service project, a lot of great speakers. There'll be 6 plenary sessions and 30 breakout sessions. So a lot of opportunity to learn a lot of different things, a lot of networking things that will be able to go along as well at the conference. So we hope that you will be able to join us and be there in person with us in August. It'll be a really great event. We look forward to having many of you there. Like I said, many of you will also be presenting at the conference, and we're grateful for those partnerships and the expertise and the talents that you will be bringing to our event. So thank you so much for all of that. Scott, anything else that you wanted to share about the conference or DEC Awareness Day?
Again, thank you for everybody who spoke today and shared. And Alan, we're really looking forward to your workshop when we get there. And I wrote down 3 questions that I want to ask you when we get to Kansas City already. So I'm doing my homework. You know, there's a couple different things that you brought up during the different things that are going on in your state. Video really works, and it's a great way to mass communicate and share a story. And for those of you that aren't aware, National DEC has a YouTube channel, and you're allowed to share any of the videos that we have on that YouTube channel. And what's really nice, if you bring up the video, you can copy the link. And if you paste that into a website, an email, it also puts that opening screen on there. So it helps the user engage and click on those videos. So you're welcome to share any of the videos that are on the National DEC website. You know, a recurring theme in the presentations today were regarding community and community making recovery possible, and community creating the prevention focus that heads off that generational cycle of substance misuse or drug activity. It's so important for all these communities to come together. So again, we appreciate you being here with us. Another thing that National DEC has done is, because we are a 501c3 nonprofit organization, we applied for the Google Ad Grant. And we've been running the Google Ads for about 9 months now, and we finally have hit kind of a nice point of uplift where we're getting a full spend of our Google Ad Grant. What that does is it provides Google with $10,000 a month to spend on your behalf promoting your ads. And so we promoted the conference, we've promoted the trainings, we've promoted a variety of different things and activities. So if you have a special program that's going on in your community that you could use some additional promotion for, let us know, because we can write a Google Ad Grant for that. And it'll get into the rotation of all of our ads. So I wanted to make sure that everybody was aware of that as well. This is such an important day, and it's become, every year it grows larger and larger, and we're seeing posts from all over the country on social media. We've got folks in DC that are engaged. So the broadening outreach is thanks to your efforts. And so we're so thankful to be partnered with all of you and all the alliances across the country, and for all the different works that you make possible and the lives that you affect and impact. So again, thank you so much.
Yes, thank you everyone so much for being here. I just in the chat just put an evaluation. Our partners at Mid-America PTTC would appreciate any feedback you can give from today's call and conversation. So if you can take some time to fill that out, that would be great to help support our partners there. All right, with that, we got everything shared that we wanted to share today. We'll let you get back to your day. Jump on social media if you can and see some of the posts that are out there, reshare those. And like Scott mentioned, even go to our YouTube page or our social media pages and be able to share things from there. But we appreciate your support today. Appreciate all the red that we're seeing. And thank you everyone for being here. Have a good
Thank you all. Look forward to seeing everyone in August.
Absolutely.
Looking forward to it. Thank you.
Me too.
Thank you.
Thanks, everybody.